Hello there, good morning. Segue muna tayo sa usual lecture series natin. I'm going to give my opinion on the hottest topic on the problem of the Omicron and the directives of the government. Ika nga, right now we are in dangerous times. And not only the Philippines, but the whole world, no? Because itong deadly coronavirus is, it seems, not bent in stopping its contagion. It is continuously evolving from COVID-19, SARS-CoV-2, tapos meron pa tayong Delta variant, Alpha, Beta, tapos ngayon itong Omicron, tapos meron pang Omicron B.2. Ano ba yan? So, itong Omicron is very contagious, no? And that is why we hear in the news always that the world now, the whole world, grabe ang surges ng mga na-infect, no? The infection can be fatal that they may lead to serious ailment or even death, especially to the elderly, those with the comorbidities, at saka yung itong hottest topic natin, itong unvaccinated. Several government policies are being strictly introduced by each country around the world, no? Just to prevent this deadly virus. Ang sa atin dito sa Pilipinas, meron din tayong mga directives and policies enforced by the government such as the No Vaccine, No Ride policy effected in Metro Manila when it was under alert level 3, no? Ngayon, several cities are enforcing the No Vax No Entry policy such as yung Cotabato City, General Santos City, Tarlac City, and Olongapo City, and it appears na ang ibang mga syudad ay susunod na rin. Pati domestic flights natin, local airlines are implementing the no vaccine, no flight policy. And in fact, yung Civil Aviation Authority of the Philippines, yung CAAP, sa Zamboanga International Airport, meron na rin silang no entry, no vaccine, no entry policy. Sa Cebu naman, mas mabigat ito. No vaccine, no entry in indoor establishments. Meron silang oplan puyok gihapon, meaning you have to stay at home pa rin. Now with this trend, I think we expect to have more policies and directives coming from the local government units and the national government. Sigurado yan. May mga opinion na kumakalat na ang No Vax No Ride policy is a violation of the human rights at anti-poor daw because it is a denial to public services. Temporarily, itong argumento na ito is moot, no? Because Metro Manila now is alert level 2. Ngayon, kasama ang No Vax No Ride policy, may mga opinion naman na nagsasabi na ang No Vaccine No Entry is in violation of the right of the people to travel under our Constitution. At sinasabi nila na ang mga direktiba na ito ay ginawa para mapuwersa ang mga unvaccinated na mabakunahan kahit ayaw nila magpabaksin. Of course, ang government naman sinasabi na ito ay valid exercise of police power. At may mga inherent o kaakibat na mga powers ang Estado kasi gaya ng eminent domain, taxation, at itong ang pangatlo, itong police power. Ito yung power ng Estado na magawa ng mga batas o direktiba to protect the welfare of the people. Sabi ng gobyerno, ang mga direktiba ay in the exercise of police power to protect the general welfare of the people in terms of public safety and health. Kaya raw, hindi ito labag sa karapatang pangtao at ang right of mobility ng mga tao may be restricted. So, with that, I tried to analyze the arguments and I have come up with some questions. No? Ito yung mga tanong ko. Can our government force its citizens to be vaccinated? Maari bang ipilit ng gobyerno na mapabaksin kayo kahit ayaw nyo? And the answer is no. The government cannot do that. It is our basic human right to refuse treatment or vaccination if we do not want to. Parang sinasabi kasi na, if I harm myself because I am not vaccinated, it is on me. This is my life and wala kayong pakialam. Okay, that argument, I have no quarrel with that. Okay yan sa akin. I agree. In fact, there is no law that punishes a person who harms himself. No? Kahit saksakin pa niya ang sarili niya basta walang madamay na ibang tao o masira na kagamitan. In fact, there is no crime of attempted or frustrated suicide. Wala yan. At least here in our country. Ha? Pwede nga yung DNR, yung do not resuscitate, na directive ng mga pasyente sa mga doctors nila before the operation na if something bad that will happen during the operation, makoma sila, wag na silang i-resuscitate. Pwede yun. It's allowed, no? That's your right. So yes, hindi kayo mapipilit ng gobyerno na magpabaksin kung ayaw ninyo. That is your right and it must be respected. So dito tayo sa second na question that came up on my mind. Can the government impose the question directives like itong no Vax No Ride policy, no Vax No Entry policy, no entry on indoor establishment, or even the no Vax No Fly policy? Kasi para daw sinasabi na itong mga direktiba na ito ay gawa para mapilit ang mga unvaccinated na magpabaksin. At isa daw itong diskriminasyon. Yan. Ang government, of course, will cling under the police power clause. Sabihin nila, ang aim namin of such directive is to protect the welfare of the people in terms of public safety and health. So, what is my take on this? Opinion ko po ito. Yeah, you could agree not to agree with me. You could agree to disagree with me. Alright, so my take is that the directives are not discriminatory. But there are some questionable holes to fill in. May mga butas na konti na nakita ko. First, analyze natin ano ba talaga ang gusto makuha or ma-achieve ng gobyerno kaya may mga ganitong mga direktiba. Klaro naman talaga na ang purpose is to prevent the spread of the contagious disease and virus, thus kailangan protektahan yung welfare ng mga tao. And so, nagkaroon nga ako ng mga questions sa purpose na yan. Una, naisip ko, itong vaccinated can still be infected and carrier of the virus, correct? Yes. And yung unvaccinated, pwede rin sila ma-infect at carrier din sila ng virus, correct? Yes. And ang severity ba ng vaccinated at unvaccinated kung magkaroon sila ng virus, parehas lang ba ang lakas niya? And the answer is yes. So, at first, I thought, sabi ko, wala naman palang kaibahan. Kasi kung vaccinated ka or unvaccinated ka, ma-infect ka pa man din pala at carrier ka rin ng COVID. So, kala ko, there is no difference, no? At kaya, naisip ko sa simula na discriminatory kapag mag-deny ka sa unvaccinated to ride a bus, an airplane, or other modes of transportation, pati na itong no Vax No Entry policy. Pero nung napanood ko ang video from World Health Organization, nagbago ang pananaw ko. I was enlightened to know that although the vaccinated and unvaccinated carries the same viral load, the same ang viral load nila, the vaccinated can clear the virus faster than the unvaccinated. The vaccinated can clear the virus faster than the unvaccinated. Meaning, yung unvaccinated people may carry the virus much longer in its body than the vaccinated and thus may possibly infect more people. Ibig sabihin po, yung unvaccinated pala na mga tao, mas lalong tumatagal ang virus sa kanilang katawan. Kaya nakakapangkalat sila lalo sa karamihan. Yung vaccinated, while ma-infect sila, pero kayang mawala kagad in a matter of days. So therefore, ang kanilang possibly na makapag-infect sila sa karamihan, mas mababa. So, with that, kaya pala na-analyze ko na kailangan itong mga unvaccinated is that may restrictions. That is, I think, the main reason why the government is doing it. And I do not know why they could not properly explain that that is the purpose. Alright, so, kasi ang main purpose natin is to achieve a herd immunity so that the virus would no longer jump from one to another. And sadly, it is difficult to achieve that if there are many unvaccinated people. Therefore, ang opinion ko ay ang mga direktiba ng gobyerno na no Vax, no Ride at no entry policy are actually not made to force people to be vaccinated but instead to prevent the spread of the virus. Hindi po kayo pinipilit na magpapabaksin itong mga direktiba na ito. Ang purpose lang po is para hindi po kumalat ang virus. Ngayon, it is not discriminatory because what it seeks to protect is the public safety and health. SALUS, POPULI, SUPREMA lex. Ito po is Latin po ito na legal maxim, no? The welfare of the people is the supreme law. Ang kapakanan ng mga tao ang pinakamataas na antas na dapat protektahan ng batas. Yan po. It is a recognition that laws and rules derive their value from how well they serve their purpose of protecting and promoting the public good. Pero sabi ko nga, meron pa rin questionable holes to fill in. How about itong mga basic necessities katulad ng food and medicine? Basic po yan, pagkain at medisina. Now, would the directive somehow affect the unvaccinated on these matters? If the unvaccinated bili siya ng pagkain sa indoor grocery store at hindi makapasok because sinabing no Vax No Entry, hindi ba discriminatory yan? At saka parang dininay mo ang basic necessities in life to buy food? Well, sabihin mo sa akin, ay, pwede ka naman mag-grab food dyan sila attorney or mag-food panda or doon sila sa open sa public market. I agree. True. Kung meron silang means to do that. But how about the poor? Those who could not do grab or food panda or those who could not go to public market without using a public utility vehicle. How could they buy medicine? For example, at mercury drug, halos lahat ito, enclosed na ito, indoor ito. So there, yan ang nakita ko na butas. No? That is the hole that I am saying, and the government must fill in and address that hole. Otherwise, the unvaccinated poor may end up in the pit of hunger and death. Hindi pa man malakas sa apoy sa maaring problema na mangyayari, no? Akin lang to, nasilip ko lang. Sa ngayon, hindi pa masyado yan umuugong yung problem na yan. At maaari pa itong apulahin habang maaga pa. So, my prayer on this is for the government to pay attention to the very poor sector of the community. That they are not denied the basic public services and basic necessities whether they are vaccinated or not. Because on those matters, the denial of it or even the difficulty in obtaining it would now be tantamount to deprivation of the basic human rights. This sector, the poor sector, also belongs to the whole community of the Filipino people who share the same rights, the right to life. Well, that is my view, guys. No? And of course, you may agree not to agree with me, or sabi nga nila, you may agree to disagree with me. So, please continue watching this video because I am sharing a video from the World Health Organization. Dagdag kaalaman po sa ating kalaban na virus and the reason why we should fight hard to get rid of it. Maraming salamat po.
We're talking about Omicron today. If it is a less severe variant, why are people still ending up in hospitals and why is it still killing people? And also, if it is this transmissible, can we really protect ourselves? Hello and welcome to Science in 5. I'm Vismita Gupta Smith. We are talking to Dr. Maria Vanker-Kove. Welcome, Maria. Maria, let's start with, if Omicron is less severe, why are people still dying from it?
Hi, Vismita. Thanks for having me again. So Omicron is the latest variant of concern, and we have increasing information that Omicron is less severe than Delta, but it is still a dangerous virus. People who are infected with Omicron have the full spectrum of disease, everything from asymptomatic infection all the way through severe disease and death. What we are learning is that people with underlying condition, people with advanced age, people who are unvaccinated can have a severe form of COVID-19 following infection from Omicron. And so we know that people are still being hospitalized with this variant of concern, Omicron, as well as dying. So it is important that we have information that is out there that is accurate, that does suggest, of course, that it is less severe than Delta, but that does not mean that it is mild.
Maria, we're seeing these reports that because it's so transmissible, eventually everyone might get it. Is that true? And if it is true, then why take protective measures?
We are certainly seeing with Omicron that there is a significant growth advantage compared to other variants of concern. Omicron is overtaking Delta in terms of circulation, and it is very efficiently transmitted between people. It doesn't mean that everybody will eventually get Omicron, but we certainly are seeing high cases and surges of cases around the world. This is putting a significant burden on our healthcare systems, which are already significantly overburdened given that we're entering into the third year of this pandemic. And if people can't receive the proper care that they need, then more people will end up with severe disease and dying. And that's something we want to prevent. So it doesn't necessarily mean that everybody will get Omicron. This is why we, as WHO, are working with partners around the world to have a comprehensive strategy to reduce your exposure and reduce the opportunities for you to get infected. First and foremost, we know that vaccination is incredibly protective against severe disease and death, but it also does prevent some infections and some onward transmission. But it's not perfect in terms of preventing infections and transmission. This is why we also recommend making sure people protect themselves against exposure, physical distancing, wearing of a well-fitted mask over your nose and mouth, making sure that you have clean hands, avoiding crowds, working from home if you can, getting tested, and making sure that you seek appropriate care where needed. All of those measures, this layered approach, are ways in which you can keep yourself safe and also protect yourself from getting infected and passing the virus to somebody else.
Maria, speak to us about why it's important to reduce transmission of Omicron.
It's important that we reduce transmission of Omicron for a number of reasons. First, we want to prevent people from getting infected because there is a risk that you can develop severe disease. There are ways in which we can prevent that, but you are still at a risk of developing disease. And if you have underlying conditions or of an advanced age, if you're not vaccinated, you can develop severe disease. Your risk is higher of developing severe disease. The second reason is that we don't understand completely the impact of post-COVID condition or long COVID. So people who are infected with this virus have a risk of developing longer-term consequences, which we call post-COVID condition. And we really are only beginning to understand this. So there's a lot to learn about this. And your risk of developing post-COVID condition, of course, is dependent on your risk of getting infected in the first place. So we want to prevent that. Third is that getting infected and having a huge case burden, this surge of cases that we are seeing with Omicron, significantly burdens our health systems as well as other essential services that are operating. The large number of cases are really making it difficult for hospitals to operate, for services to be online, public transportation, making sure we have groceries in our grocery store, schools, etc. And lastly, the more this virus circulates, the more opportunities it has to change. So this virus is circulating at an incredibly intense level around the world for a number of reasons. But the more the virus circulates, the more opportunities the virus has to change. Omicron will not be the last variant that you will hear us discuss, and the possibility of future emergence of variants of concern is very real. And more variants that emerge, we don't understand what the properties of those variants may be. Certainly, they will be more transmissible because they will need to overtake variants that are currently circulating. They could become more or less severe. but they can also have properties of immune escape. So we want to reduce the risk of future emergence of variants of concern.
Thank you, Maria. That was Science in 5 today. Until next time, then, stay safe, stay healthy, and stick with science.